Welcome to Heaven and Health Podcast. I am your host, Angel Polido. Today we are going to talk about family planning, where we're going to do matching contraceptives. Joining me is Dr. Jennings. Welcome, Doctor.
Thank you.
When you talk about Dr. Jennings, who is he?
All right. Dr. Jennings is a medical doctor who has been practicing from 2011, and at the same time, he also holds a master's degree in obstetrics and gynecology. So basically, I am a gynecologist. Yes.
When you talk about family planning, there is a lot inside of it. So today, focusing on the contraceptives. What are contraceptives?
All right. When we talk about, first of all, let us talk about family planning in general. When you talk about family planning, it is a desire that comes from a human being, from whether a male or a female, as to when they're supposed to have a child and how they're supposed to have a child. So precisely, it's about someone planning, someone providing a timeline to say, the spacing to say, my firstborn is going to be born in the next 2 years, and then I'm going to have another one in the next 5 years. So there's that spacing in between. That's what is all about family planning. So the contraceptives are there to guide someone else, to help someone else to achieve that family planning system. Yeah, so basically they're there to hinder one in terms of getting pregnancy. And so in so doing, planning as to when they're supposed to get pregnant and when they're not supposed to.
What are some of the contraceptives that are available in Malawi?
So in Malawi, we've got different sort of contraceptive methods. I like grouping them into four. There is what we call barrier method. There is hormonal methods. There are natural methods, and the permanent ones. Yeah. So four of them: the permanent ones, the barrier methods, natural methods, and the hormonal methods. So, when you talk about, let us start with the barrier methods. So in Malawi, we've got diaphragm.
Yes.
So diaphragm is a method that is provided to a woman. It's in a form of a diaphragm. It's a dome shaped. So that one is inserted into the vagina, straight onto the cervix, so that when one is having sexual intercourse, at the end of the day, the semen is barred from getting into the cervical os.
Is it like a plastic or something like that?
It's more of a flexible plastic one. Yeah. So at the end of the day, the semen will not go into the cervical os, and then one will not get pregnant.
So it will be captured by the diaphragm.
Actually, it's barred, not necessarily captured. It's barred.
Yeah.
At the end of the day, the semen will just have to call out of the vaginal orifice. Yeah. So that's diaphragm, and then we have got the most common one being the condoms. Whether it's the female condom or the male condom, they all work the same. They are barring the semen from getting into the vaginal canal. At the end of the day, one will not get pregnant. Conception will not take place. So that's about barrier methods. And then we've got the hormonal methods. So the hormonal methods are those kind of methods that usually they have estrogen or levonorgestrel hormones in them, so that at the end of the day, one will not get pregnant. They disrupt most of the times the ovulation cycle. They hinder one from ovulating, and at the same time, they also thicken the endometrium of the uterus. And on the other side, they also thicken the cervical plaque. Most of the times on the cervix, there is what we call a cervical mucus. So once that mucus is thickened, at the end of the day, the sperm will not. The semen. I'm not talking about the sperm per se. I'm talking about the semen, the fluid that the sperm that harbors the sperm.
Yeah.
Yeah, it will fail to get inside the cervical os. So, in terms of the hormonal methods, we've got Depo-Provera, the most common one. It's an injectable. This one is provided to a woman in every 3 months. Then we have the oral pills. These ones are supposed to be taken on daily basis, whether one is having sexual intercourse or not. And then we have apparently there's also an introduction of a self-injectable, which is known as Sayana. This one is a method whereby instead of a provider injecting a woman the hormones,
The
woman is trained to inject herself. So this one, Sayana, is also available in the clinics. Yeah. So and there is also intrauterine contraceptive device, the hormonal intrauterine contraceptive device. It is inserted through the cervical os into the endometrium of the uterus. And then at the end of the day, when one have sexual intercourse, the hormones that are produced by the IUCD, they are absorbed by the uterus and then into the system. At the end of the day, one doesn't get pregnant.
Does this device move around or it stays?
No, it stays. Yeah, it stays.
Okay.
It acts as a barrier, and at the same time, it also provides protection through the hormonal secretion that is provided into the system of a human being. Yeah. So that's about the hormonal methods, and then we have we also have implants. Yeah, I forgot about that. We've got implants. So the implants, we've got the 3-year implant, which is known as Implanon. Then there's a 4 to 5 year level plant. Then there's a 5-year Jadel. These are inserted on the upper arm of a human being, of a woman, I should actually say, so of a woman. So they secrete some hormones like every day. Yeah, they secrete a bit of hormones every day into the system of a human being, of a woman. Then at the end of the day, if one have sexual intercourse, they work by thickening the endometrium, as I said, or possibly thickening the cervical os, mucus, or else possibly delaying the ovulation in a woman. So at the end of the day, one doesn't get pregnant. So that's all about the implants. I mean the hormonal methods.
Yeah.
And then we have got the permanent ones. The permanent methods, we've got a vasectomy. Vasectomy is a method that is provided to a woman. I mean to a man, not to a man. This one, if you remember your very secondary school biology, there's what we call sperm duct.
Yes.
In medical terms, we call it vas deferens. So this one is the sperm canal. That's the one that the sperm
passes through.
uses as a transport system from the testicles straight into the urethra. So this one, what we do is we tie this vas deferens and then excise it or cut it. So when you do that, that means you are providing a barrier for the sperm not to pass through to the other side of the urethra. So at the end of the day, the sperm will just be absorbed into the body system, and then one will still secrete the semen, because the semen is produced on the other side. But then the semen will not be comprised of the sperm. It will just be the pure semen. So one will not even notice that there is something else missing inside until possibly we do the microscopic examination. That's when you find out that there is no sperm in the system. Because I believe what people refer to as sperm is not a sperm. It's what we call semen. It's just a fluid. Yeah. So that's vasectomy. It's a surgical procedure, by the way. And then we've got another surgical procedure, which is known as a tubal ligation. This one is provided to a woman. So at the end of the day, what we do is we provide a small incision on the abdomen, going straight into the uterus and then to the fallopian tubes. And then we tie both fallopian tubes in both directions. So once we tie the fallopian tubes, that means we have closed the distance. I mean the canal that the ovule was using for transportation from the ovaries straight into the endometrium. Yeah. So once that's been closed, that means when one has sexual intercourse and then the sperm passes through the endometrium going into the fallopian tubes, they will find that obstruction. At the end of the day, one will not get pregnant. So
Isn't that painful?
The procedures are not necessarily painful because they are surgical procedures. So surgical procedures, there are anesthetic drugs that are provided to. so that one will not feel pain. So during the procedure, one doesn't feel pain, and at the same time, when we are providing after the procedure, we also provide the painkillers. During the course of the treatment, so that the procedure is almost pain-free anyway. Yeah. So I talked about the barrier method. I talked about the hormonal methods. I also talked about the permanent method, I guess.
Yeah.
So
what are some of the benefits and drawbacks of each contraceptive method you have experienced so far?
All right, so most of the times contraception, they meet what we call misconceptions. Yeah, the myths and misconceptions that are into mostly women as well as men. They contribute a lot to the uptake of contraceptive methods. People always refer to the hormonal methods as methods that, when provided to a woman, they will reduce the taste of the sexual intercourse, the feeling that are there. Of course, yes, we've got some other contraceptive, especially the hormonal methods. They might reduce the sexual desire in a woman, but not to a man, because most of the times men are the ones who usually comes up with a statement to say, my woman is no longer the same way they were. Yeah, so
also men also feel different.
The feeling is different. That's what they talk about. But then there's a small percentage of women who are affected by the hormonal methods. Otherwise, the uptake of contraceptive methods, possibly, if you talk about the barrier methods versus the hormonal methods versus the rest of the methods, you will find out that the hormonal methods are the ones that are taken up like in a very large manner. They're always available in the hospitals and in the health centers, but then at the same time, they are very simple to use. And another thing is, even though they're available, if that's what they were, they had so many side effects, people wouldn't still come around and get them. But it is simply because they also have lesser side effects. Actually, the no method in family planning is safe to everyone. There is a bit of a contraindication as well as a side effect that is provided to at the end of the day. So you just have to choose which one is better suiting you than the rest of it. Yeah, so most of the times the uptake is reduced by the misconceptions. People talk about the condoms, providing rush to them, just running away from using a condom anyway. Yeah, and the people talk about the pills aiding up cancer as well as hypertension. But then we still have cancer, we still have hypertension despite the pills. So mostly it's the misconceptions and the myths that are provided to that those are the ones that are reducing the uptake of family planning methods. Yeah.
You say so far that the contraceptive methods also have the side effects. What are some of the side effects that you have come across so far?
All right, so every method has a side effect, but I'll just talk about in general the way I categorize them into four. Yeah, I can just talk about the general side effects that I provide, because most of the methods in those categories have got the similar side effect. Yeah. So if you talk about the barrier methods, the condoms, yeah, people talk about reduction of sensation. Yeah, and at the same time, it has to be properly used. There's a small percentage of bursting during intercourse, but it's a very small percentage. Even though people come around with those complaints to say, I was having sexual intercourse and then the condom burst, but most of the time you find out that they haven't really used it at all. Yeah, so it's a method which is very good, but then at the same time, the sensation is reduced in the condoms. There is a small percentage of people reacting to the fluid, to the lubricant, but a very minute percentage. The barrier method that I talked about, the one that is provided to the diaphragm, once it slips, there's a high chance of failure. One can get pregnant. There's a high chance of failure. Yeah, so it has to be properly inserted by an expert. A woman has to be really trained to do that, and it's not very common. That's one of the issues. When you talk about the hormonal methods, The hormonal methods that have got the common side effect is prolonged menstruation. Yeah, that's some other individuals, once they have used the method, they take up to several days or several weeks, with spotting or possibly the menstruation itself. But that also depends on the hormonal makeup of that woman who has been provided to. But there is also a treatment for that side effect. Once that person encounters the side effect, if you come to the hospital, we'll provide the treatment. There is also another side effect of migraine headaches. If one is also hypertensive, the hormonal methods, they might also aid up the hypertension itself and then bringing about, the prolonged headaches and the dizziness. There is another side effect of a dry vaginal orifice, vaginal canal, because there is a disruption of those hormones. So at the end of the day, you'll find out that the hormonal makeup is also one of the contributing factors to one of providing the vaginal fluid. That one acts as a lubricant. So once the hormonal disruption has been achieved, at some point the vaginal orifice becomes dry. Then at the end of the day, one might also complain on that. Another side effect, a bit of failure anyway. There is a small percentage of failure in terms of methods, especially the contraceptive pills and the emergency contraception. These ones have got the high failure rate, possibly about 75%. Yeah, but the implants, they go as far as 95 to 98% of failure, so which is quite good anyway. Yeah. When we look at the permanent methods, the irreversible ones, one of the side effects is simply because they are surgical procedures. So surgical procedures have got the side effect of the commonest one is pain. We cannot achieve 100% pain-free procedure. Yeah. So that one is another side effect. Another one is simply because it's a wound that is created. If the human being is not really hygienic, at the end of the day, there might also be some wound gaping, some wound infection. So at the end of the day, one might also develop a bit of infection, but that's also not very common, but it's also a side effect. So basically, the side effects, there was at some point when there could be a reunion of the gaps, especially in the tubal ligation. When one usually what they were doing at that in those archaic days, they were just tying them. They were not excising. They were not cutting them. So once the suture has been absorbed, the canal would reopen, and then one would get pregnant, possibly after 10 or 15 years. But that doesn't happen nowadays. If it happens, that means it's the failure of the surgeon, not the procedure itself. Yeah. So that side effect is gone now, simply because we found a different method. If you talk about I missed the natural methods. I think so. I missed the natural methods. I did not talk about that. Yeah. So we also have natural methods. So natural methods, they're the ones that people use the calendar as well as
after they count down like their days for a period.
Yes. As well as they'll also look at the cervical mucus. The vaginal discharge. Yeah, thickness of the vaginal discharge will tell whether you're ovulating or not. So this one has a very high failure rate, because sometimes ovulation doesn't go around with menstruation cycle. There can be a disruption. So once there's a disruption, definitely one gets pregnant. So this one has a very high failure rate. I think that's one of the commonest methods that provides to that usually people come with unwanted pregnancies. Yeah.
Okay, our bodies were made that. Okay, in the female body, the ovules are supposed to be released, and in the man's body, the sperms are supposed to be released. And you said that you cut out the sperm duct, and in the other side, you said that you tie up the fallopian tubes.
The fallopian tubes.
Yeah.
Yes.
So if there's if the person is not releasing the sperms and the ovules, aren't there any side effects?
No, there are no side effects. There are no side effects. Actually, there are so many things that are released in our body But then simply because they are not excreted outside our body, the body has a way of excreting everything. It has a way. It absorbs everything. Everything that is left inside, it's really absorbed, because those are proteins. The sperm, yeah. Apparently, there's a lot of times when human beings don't really have sex. One can stay up to a year or two without having sex. I'm not actually saying they can go beyond that. They can. But then at the end of the day, where do those sperms go? They die. Then they're absorbed. So that's the same way. What we're trying to achieve is, like, we are telling the testicles that they are no longer needed. Yeah. So instead of cutting off the testicles, we just cut the tract. Because if you cut the testicles, then obviously there is also disruption of hormonal contribution. Testosterone is also contributed by the testes. That means we are transforming that human being into something different. Yeah. So we're only trying to cut off what is really paramount in terms of reproduction, but then at the same time we still have to release the semen, so that every sexual intercourse will solely look like the way it's supposed to be. There shouldn't be that differentiation of how it was before the procedure and how it is after the procedure. Yeah.
Looking on the barrier methods, the hormonal methods as well, and the natural method as well, can one be able to combine these methods?
One can be able to combine a hormonal method as well as a barrier method. It's possible, especially a condom. Yeah, because the contraceptions don't achieve protection from HIV. Yeah, so they solely don't do that. They're only there to prevent pregnancy. So there are times when one doesn't have faith in the human being they're having sex with. So despite having a method in the body, in the system, they also can use a barrier method, especially the condoms, just to make sure that they are protected from HIV. So one can combine. But then if you combine a hormonal method with another hormonal method, then you have achieved possibly above threshold level of the hormones in the system. Then you should also expect above threshold side effects, which is not okay.
What if you combine hormone contraceptive and contraceptive pills?
They are the same. The hormonal contraceptive pills are amongst the list of the hormonal methods.
Okay.
Yeah. So if even emergency contraception is also a hormonal method. So if you do that, then you should expect a lot of side effects.
What type of contraceptive pills? What kind of contraceptive methods can you recommend for teenagers?
I can recommend almost every method apart from the permanent ones. Yeah, the permanent ones are not meant for teenagers, because teenagers haven't yet, most of them, they haven't yet given birth. So if you provide a permanent method, in the near future when they want to have a child, obviously they want. And that also becomes a problem. We have had cases whereby, couples coming to the clinic to say, I would like to permanently have a family planning method. You provide a triple ligation, and later on when they separate or divorce, they remarry, the woman will come back to you and say, untie my tubes, I want to give birth, which is not possible at all. Yeah, so we would want one to have a very strong desire not to give birth. That also comes with age. We're not saying it's not important to do that. It is, but then age is one of the factors that contributes to one having a permanent method. So in teenagers, that is not recommended. But then teenagers can get contraceptive pills, they can get emergency contraception, they can be provided with implants, even the IUCDs, even though intrauterine contraceptive devices are not recommended to individuals less than 20 years of age because of the shortest endometrial distances. If they are provided with, they are very easy to slip off. So we actually say that one can be provided possibly if one gives birth. Yeah, because at that particular moment, then the endometrial distances have been lengthened to a level that contraception will be achieved. But otherwise, youth can come around and take each and every method they would like to get, apart from the mentioned ones.
So how do contraceptive pills, contraceptive methods interact with other medications? Maybe for someone is taking some other medications and you're also using contraceptive pills. Is it okay?
No, the drugs which will reduce the potency of a contraceptive method. Yeah, there are some other antifungals, some other antivirals. Once they combine it, even the anticonvulsants like the phenobarbital, the one that is provided in people with epilepsy, that drug will reduce the potency of a contraceptive method, especially the implants. So if you have one individual who is using a hormonal contraceptive method and at the same time they are also taking phenobarbital, the chances of one getting pregnant whilst the method is in situ are very high. And the same applies to grisofarvin, which is an antifungal. It also does the same thing. Yeah, and some other antivirals as well, especially they react with Jadel. Even though government haven't yet talked about it, but then I also encountered a lot of individuals with such kind of issues, having Jadel for 5 years, and then at 2.5 to 3 years, they get pregnant. Yeah, because of some other antivirals which react to them. Yeah, so most of the times we actually say that when you're taking a drug and then you're also on a contraceptive method, it's better to get back to the hospital and discuss with the doctor. Say, I'm using this drug. Is it going to contraindicate with this? And then you react and have the side effect. Because what we want is one to achieve what they desire. Yeah.
So what community resources provide contraceptive services here in Malawi?
The community that provides. Almost, a lot of people can access family planning methods. The pills and the images of contraceptives, in a lot of pharmacies. The other methods that are provided to in the health centers as well as the district hospitals, even at the central hospital level, you can get almost any method that you want, almost. And we, as government, has also created youth-friendly health services because they understand that youth are failing to get the methods simply because they don't want to line up with the mothers and fathers, seeking the method. So we try as much as possible to exclude the youth and then possibly put them on a different shell so that they are free to access whatever the method they're having, because we know youth are having too much sex.
Yeah.
And at the same time, they also exposed to these the unwanted pregnancies. So we want to achieve an environment whereby one gives birth because they desire it, not just because it has happened. Yeah.
Even though the contraceptive methods, they are all recommended here in Malawi, but you as a gynecologist and a person who has a lot of experience, which one do you recommend most?
I don't have a clue as to which one is the best, because they are very suitable at different spaces at different ages. Yeah, at different levels. Yeah. If at all you have achieved your reproductive goal, you would want to have 4 children. Why would you go for a contraceptive pill? Why would you go for an emergency contraception? That means you have to look forward to the permanent method.
Yeah.
If you're a youth and then you're seeking for a permanent method, in the next 5 years, if you're to get married, why would you? What are you going to do if the husband seeks for a child? Yeah. So if at all you are HIV positive and your partner is HIV negative, you are not even on any other PrEP or PEP methods. Why would you go for the other methods apart from the condoms? So there are circumstances that hinder one from getting a method, and there are also circumstances that provokes one to get a different method. So every method is very important, and there are some which also reacts to different human beings. So we'd want one to have a method that is suitable for them at that particular time. Yeah.
These are some of the contraceptive methods that Dr. Jennings has explained so far. So you can agree with your partner and choose the best method which works out best for you. Thank you very much for listening.